Joining me right now is Tennessee Senator, member of the Armed Services Committee, Judiciary and Veterans Affairs Committees, Marsha Blackburn. Senator, it's good to see you this morning. Thanks very much for joining us.
Good to see you. Thank you.
How much money do you think is required for preparedness?
We don't know. Yes, we don't know exactly what is going to be needed because we don't know exactly what is going to be in front of us. We should be very grateful that the president moved aggressively, moved quickly, imposed the travel restrictions, and that is one of the reasons that we are seeing the type containment that we have. We have about 60 people that are in quarantine, and that includes the 15 that have received a positive diagnosis. And I think that being on the front end of this and exercising these precautions immediately shows the difference in the way it has been handled here and the way it's been handled in other countries.
Well, it's really sad to see all of the politics now coming out in the face of all of this. I mean, the president did right off the bat say no travel to and from China. And he stopped all travel going to China when this first broke. And a lot of people criticized him for that. Meanwhile, in retrospect, that was the right move. Because, I mean, certainly China criticized the U.S. for stopping all travel, even as they have people locked down in their homes, Senator.
Well, you're exactly right. But this is one of those areas where he made a decision. It didn't take him, he didn't have to committee it to death. He said, this is the problem. Let's lock down this travel, impose these restrictions, and then assess the situation. And with the case in California, the CDC is doing the right thing. They're investigating it. There is concern over this being community spread. I think we're going to find out more regarding this patient in this case today, and let's allow the CDC to do their work. The point is we have to be flexible. We have to be vigilant. If the CDC, the NIH say we need this or we need that, we need to do it. You have University of Nebraska that is leading a good bit of this infectious disease research. You have mentioned Gilead and the work that they are doing. All of these, look how quickly we have pivoted and have made this priority one. And Maria, you were talking about the pharmaceutical ingredients earlier, and Anna Eshoo, a Democrat out of California who's in the House, she and I started about 10 days ago working on legislation to address this issue, to bring these ingredients back on shore in the U.S., to bring this manufacturing back, and we're ready to move our bill forward. I
mean, when you look at the reliance that America has on China, most people don't understand how significant that reliance is. 70% of prescription drugs and generics are made in China and India. 70%? I mean, this is a scary number, not to mention other things like parts and components, which I said right off the bat we were going to see shortages there. But when you're talking about things like drugs that people need for their own health, you recognize the reliance here. And how soon can that happen in terms of your bill and actually getting companies to say, I need to manufacture here?
Well, and there are two parts in our bill. One will bringing these strategic stockpiles back on U.S. shores, and the second is going to be to incentivize that production so that we're again making penicillin in the country. We are making vaccines in the country, things that we have not done. And this is the danger when you have regulatory policy that pushes this offshore and you get into a pandemic situation or an outbreak situation. This is what you face, and this is why we've worked so diligently to get this in shape, to file the bill and then move the bill forward.
Yeah, but at this point now we're in a crisis situation. We need to get our hands on things now. A growing number of colleges are suspending study abroad programs. They're even canceling classes amid this widespread outbreak. Vanderbilt, the University of Tennessee are two of your state's largest schools. The University of Tennessee announcing it is suspending all spring and summer abroad programs in China and South Korea. There are currently no confirmed cases of the coronavirus in Tennessee, but with spring break just around the corner, how are these universities taking precautions when we know we don't have enough test kits? That's one of the things we need, the test kits. are in short supply, as are plastic gloves, masks, again, all made in China.
You're exactly right, and this is why I think it was wise for the president and the vice president to say we are shifting our focus, we are shifting resources to make certain that we are prepared. We are working with all of these state health agencies to make certain that they have a plan in place. And they're not waiting for something to happen. They are saying, get ready in case it does. Let's be judicious in the process that we're going to move forward. And there again, whether it be from the funding end, the appropriations end, looking at legislative policy, looking at laws that are on the books and saying, what has to be modified so that we are more agile in our response? What do we need to do to be sure we don't get in this pickle again, where you have most of our pharmaceuticals being manufactured in China, in India, and we do not have the capacity for the rapid response that we need.
I want to share with you something that one of your colleagues said, Senator Marco Rubio, because Marco Rubio says, we have never faced that sort of vulnerability in the backbone of our countries. China's potential to carry out a crippling attack against the U.S. satellites has commanded attention from military strategists and diplomats for years. But Marco Rubio says this: imagine if on the eve or on the verge of a conflict, we're aware of China's ability to, or they demonstrate their ability to, deny a significant amount of a number of Americans to access their banking information, their telecommunications, their internet connectivity, the mass transit system of a major city, or the combination of all of that, a utility network. He's talking about Huawei networks and the fact that China can turn it on and turn it off if Huawei infrastructure is in the United States and cause serious chaos for this country.
Well, and he's exactly right. This is why I'm doing so much work and chairing and leading this tech task force at Judiciary Committee. We do not need Huawei systems in the U.S. We do not need them with our allies.
All right, so you agree with that. I just wanted to see if you agree with that. Real quick, Senator, before you go, I got to ask you about the Sanctuary City showdown. In a win for the president, a federal appeals court has ruled that the administration can withhold funds from 7 states and New York City for not cooperating with U.S. immigration authorities. Your reaction?
I agree with the Second Circuit's decision on this. A couple of weeks ago, I filed the Stop Greenlighting Driver's Licenses for Illegal Aliens legislation, and that would bar these DOJ funds from going to these sanctuary cities. If you're not going to comply with federal law and work with federal officials to enforce U.S. law, then you ought not to get these federal funds.
Yeah, I could see that. Senator, it's good to talk with you this morning. Thanks so much.
Good talking to you. Thank you.
Senator Marsha Blackburn joining us there in Washington.